Ever wonder how much you really know about infectious diseases? Today, we'll put that knowledge to the test. Infectious diseases, the unseen threat, can lurk anywhere, from the air we breathe to the food we eat. Understanding these diseases isn't just about knowing their names, it's about recognizing their symptoms, knowing how to treat them, and most importantly, learning how to prevent them. Ready to dive into the top 10 most common infectious diseases? Buckle up, this journey is about to get interesting. Coming in at number 10, we have influenza, more commonly known as the flu. This infectious disease can strike anyone at any time, causing symptoms that range from mild to severe. These include a high fever, cold chills, muscle aches, coughing, and a general feeling of being unwell. Some people might even experience severe complications like pneumonia or inflammation of the heart. The good news is, influenza is treatable. Over-the-counter medications can help manage symptoms, and antiviral drugs may be prescribed by your doctor to lessen the severity and duration of the illness. But remember, the best treatment is prevention. Practicing good hygiene, like washing your hands regularly, can help stop the spread of the flu virus. However, the most effective prevention tool is the flu vaccine. It's updated every year to combat the most current strains of the flu virus. So, don't forget to get your annual flu shot. Remember, a simple annual flu shot can keep this infectious disease at bay. Moving on to number 9, we have strep throat, a bacterial infection that causes a sore, scratchy throat. This pesky infection is caused by the Streptococcus pyogenes bacteria and is most common in children but can affect people of all ages. The symptoms are fairly recognizable and include a sore throat, swollen tonsils, tiny red spots on the roof of the mouth, and fever. Treatment for strep throat is typically a course of antibiotics to kill the bacteria. It's essential to complete the full course even if symptoms improve, to prevent complications like rheumatic fever or kidney inflammation. Prevention is always better than cure, and with strep throat it's no different. The bacteria spreads through droplets in the air, so maintaining good personal hygiene is critical. Frequent hand washing, covering your mouth when coughing or sneezing, and avoiding close contact with infected individuals can significantly reduce your risk. Frequent hand washing and avoiding close contact with infected individuals can keep strep throat away. Next up, at number 8, we have hepatitis, a disease characterized by inflammation of the liver. There are 5 main hepatitis viruses referred to as types A, B, C, D, and E. Symptoms can range from mild, such as fatigue and nausea, to severe, including jaundice and liver failure. Now let's talk treatment. This largely depends on the type and stage of the hepatitis. For instance, acute hepatitis A and E often resolve on their own. However, chronic hepatitis B and C may require antiviral medications to prevent liver damage. Prevention is, of course, the best cure. Safe and effective vaccines are available for hepatitis A and B. No vaccines exist yet for hepatitis C, D, or E, but you can reduce your risk by practicing good hygiene and avoiding risky behaviors like sharing needles or having unprotected sex. Vaccinations exist for some types of hepatitis, so make sure to keep your immunizations up to date. At number 7, we find tuberculosis, a serious infectious disease that mainly affects your lungs. This silent assailant, also known as TB, is caused by the bacterium Mycobacterium tuberculosis. It's a stealthy invader, as many people with TB have no symptoms because it's often latent. However, when it becomes active, symptoms may include a persistent cough, chest pain, and coughing up blood. Now let's talk treatment. TB is a tough nut to crack, but it's not invincible. With a timely diagnosis, a health professional can prescribe a course of several antibiotics over a few months. It's crucial to stick to the medication schedule, as incomplete treatment can lead to drug-resistant forms of TB. Prevention, though, is better than cure. Regular screenings, especially if you're in a high-risk group, can catch TB before it becomes active. The BCG vaccine can also offer some protection, particularly for children. Remember, regular screenings and vaccinations are key to preventing tuberculosis. Coming in at number 6, we have HIV/AIDS, a life-threatening condition that severely damages the immune system. This infection, caused by the human immunodeficiency virus, progresses in stages, with symptoms varying from flu-like conditions in the early stages to severe weight loss, chronic diarrhea, and life-threatening infections in the advanced stage, known as AIDS. While there is no definitive cure for HIV/AIDS, antiretroviral therapy or ART can control the virus and prevent its progression to AIDS. It's crucial to start treatment as early as possible for the best results. Preventing HIV/AIDS is about more than just knowing how to protect yourself. It's about making those protective measures a regular part of your life. Condom use, regular testing and treatment for those who are positive are key strategies in the fight against this disease. Pre-exposure prophylaxis, or PrEP, is also an effective prevention strategy for those at high risk. Practicing safe sex and getting tested regularly can help prevent HIV/AIDS. At number 5, we have malaria, a life-threatening disease caused by parasites that are transmitted to people through the bites of infected mosquitoes. Malaria is a stealthy foe, often beginning with flu-like symptoms. The infected person may experience fever, chills, headaches, sweats, fatigue, nausea, and vomiting. As the disease progresses, it can lead to severe anemia, respiratory distress, and organ failure, which can be fatal if not treated promptly. Luckily, malaria is preventable and treatable. Anti-malarial drugs are available to treat the disease, and early diagnosis is critical for successful treatment. Prevention, though, is always better than cure. Strategies to prevent malaria focus on two main tactics: vector control, which aims to reduce mosquito populations and their lifespan, and personal protection, which reduces contact between mosquitoes and humans. Personal protection methods include using insect repellents, wearing long sleeves and pants, and most importantly, sleeping under a mosquito net, especially in high-risk areas. Using insect repellent and sleeping under a mosquito net can help prevent malaria. Next up, at number 4, is pneumonia, an infection that inflames the air sacs in one or both lungs. This inflammation can cause a variety of symptoms such as a cough with phlegm or pus, fever, chills, and difficulty breathing. In some cases, it can also lead to severe illness or even death, particularly in people with weakened immune systems, infants, and the elderly. The treatment for pneumonia primarily involves antibiotics, antiviral medications, or in some cases, fungal medicines, largely depending on the cause of the infection. Hospitalization may be required for severe cases. Prevention, however, is the best strategy against pneumonia. This involves getting vaccinated with the pneumococcal vaccine and the flu vaccine, which can prevent certain types of pneumonia. Good hygiene practices, such as washing hands regularly and disinfecting frequently touched surfaces, can also help prevent the spread of germs that cause pneumonia. Getting vaccinated and practicing good hygiene can help prevent pneumonia. Coming in at number 3 are diarrheal diseases, typically a symptom of an infection in the intestinal tract. These diseases can be caused by various bacterial, viral, or parasitic organisms, mostly spread through contaminated food or water. The symptoms are quite recognizable, including loose or watery stools, abdominal cramps, fever, and sometimes nausea and vomiting. Now you might be wondering how to treat these uncomfortable conditions. The primary goal of treatment is to replace lost fluids and electrolytes. Hydration is key. Over-the-counter medicines can also help manage symptoms, but it's always wise to consult with a healthcare professional before self-treating. Preventing diarrheal diseases revolves around hygiene and sanitation. Washing hands thoroughly and regularly, especially before handling food, can significantly reduce the risk of infection. It's also essential to ensure your water is clean and safe for consumption. Remember, contaminated water is a common source of these diseases. Maintaining good personal hygiene and consuming clean water can help prevent these diseases. At number 2, we have the common cold, a viral infection of your nose and throat. This ailment is as familiar as the morning sun, and yet it still manages to knock us off our feet every time. Common symptoms include a runny nose, congestion, cough, and a general feeling of being unwell. The discomfort can last for a week or more, but rest assured it's usually harmless. The common cold is a self-limiting disease, meaning it resolves on its own without needing specific medical treatment. However, over-the-counter remedies can help alleviate the symptoms. Hydration, rest, and good nutrition are the keys to a swift recovery. While there's no surefire way to avoid the common cold entirely, prevention is still the best medicine. Regular hand hygiene is crucial. Use soap and water or an alcohol-based hand sanitizer. And remember, avoid close contact with those who are sick. Remember, washing your hands often and avoiding close contact with sick people can help prevent the common cold. Finally, at number 1, we have COVID-19, a novel coronavirus that has affected the world in unprecedented ways. Originating in late 2019, this disease rapidly became a global pandemic. Its symptoms range from mild to severe, with some people remaining asymptomatic. Common symptoms include fever, cough, and difficulty breathing. However, it's important to note that these symptoms can be similar to other respiratory illnesses. In terms of treatment, most cases can be managed at home with rest, hydration, and over-the-counter medication. Severe cases may require hospitalization and even intensive care. The medical community has been working tirelessly, and several vaccines have been developed in record time. Prevention is the best way to combat COVID-19. This includes wearing masks, maintaining social distancing, washing hands frequently, and getting vaccinated. Vaccination not only protects you, but also helps to reduce the spread of the virus in the community. Wearing masks, social distancing, and getting vaccinated are key to preventing the spread of COVID-19. And there you have it. The top 10 most common infectious diseases. From influenza to COVID-19, each poses unique challenges and calls for particular measures of prevention. It's essential to remember that early detection and prompt treatment can make a significant difference in outcomes. But the true key lies in prevention, through hygiene, vaccinations, and health education. Remember, knowledge is power. Understanding these diseases can help us prevent them and stay healthy.